You ever look at a prescription bottle and see that super specific instruction? Take one pill every 8 hours. It seems so precise, doesn't it? Well, today, we're going to pull back the curtain on the hidden science behind that simple direction. It's a really fascinating look at how medicine is designed to work perfectly inside your body. Right? It's not just some random suggestion. That timing is actually the result of some really precise calculations, a whole strategy to make sure a drug is both safe and effective. So let's break down how they actually figure that out. So, the first piece of this whole puzzle is understanding the number one goal of any medication. It's not just about, getting a drug into your system. It's about getting the exact right amount of it where it needs to go. And that leads us to this concept called the therapeutic window. You can think of it as the Goldilocks zone for medicine. If the concentration is too low, it's pretty much useless. But if it's too high, you start risking side effects, or even worse, toxicity. Every single dosing instruction you've ever gotten has one goal: keep the drug level floating right in that perfect sweet spot. Okay, so how do doctors actually keep us in that window? Well, ideally, what they really want is to achieve this perfect balance, a state where the amount of drug coming into your body is perfectly matched by the amount your body is getting rid of. And to get our heads around this, let's use a super simple analogy. Just picture your bloodstream as a bucket with a small hole in the bottom. Okay, check this out. The faucet pouring water in, that's the drug you're taking. And the leak at the bottom, well, that's just your body naturally clearing the drug out. The real magic happens when you get the flow from that faucet to perfectly match the flow out of the leak. The water level just stays constant. In medicine, we call that perfect balance steady state. And here's the official definition for you. At steady state, or C-state, the drug's concentration in your blood plasma basically flatlines and becomes constant. The rate in equals the rate out. This is the absolute ideal situation, keeping you right in the middle of that therapeutic window. But there's a problem, a pretty big one actually. Getting to this perfect steady state just by starting a regular dose, well, it takes a really, really long time. So how long are we talking? It takes about 5 to 6 half-lives of a drug to reach that steady state. So, what's a half-life? It's just the time it takes for your body to get rid of half the drug. So, if a drug's half-life is, say, 4 hours, after 4 hours, half of it is gone. After another 4, a quarter is left, and so on. This means 5 or 6 half-lives could be a whole day, maybe even longer, before the medicine is even working at its best. Thankfully, medicine has a pretty clever shortcut for when we just can't afford to wait around. It's a way to completely bypass that long ramp-up period and get the drug working right away. Exactly. I mean, think about it. If you're in the hospital with a serious infection and the antibiotic has a 6-hour half-life, you'd have to wait 30 hours. That's more than a day for it to reach its best concentration. Nobody has time for that. So doctors use this brilliant 1-2 punch strategy. The first punch is a big initial loading dose. Think of it like just dumping a whole bucket of water into our leaky bucket all at once. Its only job is to fill it up fast and get the drug concentration into that therapeutic window immediately. And then comes the second punch, smaller, regular maintenance doses. These are designed to do exactly what the faucet did in our analogy. They just replace the exact amount of drug that your body clears out between doses. It keeps that level steady and effective. Now, that whole loading and maintenance dose model is perfect for something like a continuous IV drip in a hospital. But what about for the rest of us? Just taking a pill every few hours. That's where things get a little wavy. This slide shows the difference perfectly. On the left, a continuous IV infusion gives you that beautiful flat line of a perfect steady state. But on the right, that's what happens with pills. You get this sawtooth wave. The drug level spikes up after you take a pill, then it gradually falls as your body clears it, until you take the next one and it spikes right back up again. So this wave gives us 2 new critical points to manage: the peak, or CS max, which is the highest the concentration gets, and the trough, or CS min, which is the lowest point right before you take your next dose. And the whole goal of that prescription label, that 1 pill every 8 hours, is to make sure this entire wave, from its highest peak to its lowest trough, stays safely inside that therapeutic window. Okay, so let's put it all together. Let's see how a doctor actually designs that regimen. How do they choose not just the dose, but the interval between doses? Now, this is where it all clicks. Look closely. All 3 of these options deliver the exact same average amount of drug per hour, 25 milligrams. So you'd think they'd have the same effect, right? Nope. Look at that fluctuation column. A smaller dose taken more often creates just a gentle little wave. But a bigger dose taken less often creates these huge peaks and deep valleys. And that brings us to the single most important takeaway from all of this. The time between the doses is just as crucial as the size of the dose itself. The longer you wait, the bigger the swing between your peak and your trough, and that increases the risk of the drug either not working at all or causing side effects. So the next time you look at a prescription bottle, you'll see it in a whole new light. It's not just a set of rules, it's a personalized strategy. It's a carefully designed balancing act, crafted to make sure your medicine works just right for you. Thanks for diving into this with us.